Lorian, when Danielle Smith wrote this article, it's almost in a way a blueprint for some of the changes that she's making now in Alberta healthcare. And it's really an eye opener because this essay has not received much public discussion at all. And yet, I think it's really important. It's a view into how she sees the healthcare and the future of healthcare. Would you agree?
Yeah, and I think that even before Premier Smith, under Premier Kenny, there was this trend in the healthcare system towards more privatization, more corporatization, and more centralization of power over the healthcare system within the government, more government control. And so you can really see this play out with the reorganization of Alberta Health Services, with the increased contracting out of surgeries to private entities. All of these things really move those trends along. And then with respect to the corporatization piece, you have the entry of some large corporations into the primary care space in Alberta. So really big shifts that started with Kenny and are really being brought to roost under Smith.
This essay that Danielle Smith wrote in 2021, Alberta's Key Challenges and Opportunities, was published by the School of Public Policy at the University of Calgary. It's not an academic paper per se, so it kind of stands out amongst the other chapters of the book, actually, is what it turned out to be. But here's what she says about the core problem confronting Alberta, and healthcare is just an example of this. She says Alberta can no longer afford 100% taxpayer funded social programs. For anybody who was raised, since Medicare came in the 60s, that's an earthquake in terms of public policy. Would you agree?
Yes, and I think it's rather short-sighted. And so if people have poor access to healthcare services, then often their conditions end up getting worse. They end up in the emergency room. They end up with much more severe chronic conditions than they might have had if they could have sought treatment immediately. And we can look at the US. You can look at the US and you see that play out. You see people avoid seeking medically necessary care until their situation is quite dire. The other thing that you see in the US that we'll see here, if we start to get into this thing where you have multiple payers, you have the private insurance, you have the public insurance, you have individuals paying, is you end up with tremendously high administrative costs. And so I worry about this rhetoric around we can't pay for everything. No one is suggesting that you pay for everything, but some of the systems that Smiths points to as being successful, some of those European systems, she points to them as saying, well, they have privatization, we could too. What they actually have is much higher public spending than we have, and they have broader coverage of pharmaceuticals, dental, better integration of the healthcare system with social services. And so, arguably, we actually need more public system, not less public system, to be one of those high performing healthcare systems that she often cites.
It's interesting that you talk about inefficiency if it was more there was more private or more choice in the system, because one of the things she cites is rising costs, and she points the finger directly at inefficient bureaucracy. She says the administrative state, as sort of the right wing that she belongs to like to call it, and she says it's their inefficiencies that are causing costs to go up. Would you agree or disagree with her?
I think that, of course, in any system, whether it be a public system or a private system, there are efficiencies to be found. And so, could we have made reforms to Alberta Health Services rather than blowing it up that would have found some efficiencies? Of course. No system is 100% efficient. But I reject this idea that the private system is somehow more efficient at delivering healthcare services. To the extent that you can point to data suggesting they are, that's often because they're cherry picking the quick, easy, uncomplicated cases. And if that's all the public hospital was doing, they too could be a lot more efficient than they are, but they can't cherry pick who they see. And then the other thing that the private system that sometimes people point to with the private system is this assumption that it's more efficient from a cost perspective. But what we've seen in Alberta, not just recently, but if we go back to a previous experiment with private orthopedic delivery, is we can see that the private system often costs more have to carve out a profit. So they have to charge the government not just the cost of delivering the service, but there has to be a profit built in. And then the final thing I would say on that point is that the government has talked a lot about this reorganization of the healthcare system as being about efficiency, but they've created four new health delivery structures. There's a new integration entity. There's, of course, new functions within government. And so I don't see how all of that is going to result in significantly fewer bureaucrats than Alberta Health Services.
Another line that she uses is that the issue isn't lack of compassion, it's lack of innovation and realism. And she often goes back to this idea that Alberta is a bastion of free enterprise and market forces and innovation. And if you just unleash those, then they would somehow magically transform the healthcare system and produce lower costs and higher efficiency. But it's an assumption, it's not proven with any evidence.
That's right. And the concern with this innovation argument, which is often just a stand-in word for privatization, for corporatization, there are concerns with that in the health system. One concern is, of course, the significant information asymmetry between the patient and those delivering services or those innovators who are creating new products or new systems within the healthcare system, is that it's difficult for them to evaluate the quality of those innovators, especially if they're in a vulnerable state of illness. And so you can end up with this situation where patients don't know if the quality of care that they're getting from some of these private companies is good, bad, or otherwise. And we have a government that I don't think wants to regulate some of these private delivery organizations to ensure that quality remains high. We've seen in the US that a lot of regulation is needed to keep some of these private actors in line in the healthcare space. And then, of course, these private entities aren't just beholden to patients in the way that self-regulated health professionals are. These private entities have duties to shareholders, have motivations to carve out profits that we don't necessarily see in a public system. And those motives can be at odds with high quality, equitably accessible, cost-effective care.
I think it's well understood by Canadians that actually don't have 100% of our healthcare costs covered by the public system. There's all kinds of things like prescriptions and dental care and optical care and so on that are outside the public system. But given what we have as the core of Medicare, Smith, as I understand this paper, is advocating for what she calls a hybrid public-private financing model so that more of over a period of time, much more of the public funding gets transferred over to a private side. And even though they might come, and eventually the government doesn't have to pay for it. And she talks about, this is what really caught my eye. She talks about getting the Alberta taxpayer used to paying out of their own pocket for their health care. They're not now, but give them a little while and it'll be just a standard operating procedure.
Yeah, and so the issue with this is really one of health equity, that if you make people pay, the people who aren't going to be able to pay are often those who are the most sick. There is a link between wealth and health, and those who have a particularly poor health status are often those who don't have financial resources at their disposal to buy private healthcare services. And so if we go down the path of downloading more costs off onto taxpayers, we will see this gap widen. And we can see it in countries like the US, who actually does spend a lot on their inefficient public system that has to sort of interact with and with the private system. But um, we see a huge health gap where people are relying a lot on a private system to obtain health services. And so that's really the issue here, is that health disparities will increase. And we know from the pharmaceutical context that people are sensitive to price. In Canada, there is a not insignificant amount of people who don't take prescriptions, don't take the whole prescription, cut the pills in half, do all sorts of things because of the cost of drugs. And we will see the same thing happen with other healthcare services if those costs are pushed off onto individuals. And then those people will end up in emergency rooms or will end up with chronic diseases that are much more severe. So if we look at something like diabetes, that's very common. If you are poorly managing your diabetes in the community, you can end up on dialysis. You can end up amputations. You can end up, the potential consequences are very severe.
Another point that she makes, and we'll wrap up the interview with this, is talking about the fiscal implications. So when she was writing in 2021, there was a $12 billion budget. She thinks that her reforms that she's advocating would free up another $4 billion, but she never talks about any other options. I mean, there could be a sales tax that's commonly discussed, unpopular maybe amongst voters, but nevertheless. Then there are corporate taxes. I mean, the Kenney government you referred to dropped the corporate tax from 12% to 8%. There is, there's royalty revenues. There's all kinds of ways other than creating this hybrid public-private financing model, and she considers none of them.
Yeah, and that's unfortunate, but it's typical of this government. We've seen a number of position papers or policies that have come out from them where they hone in on a specific example or option, and then kind of after the fact try to come up with justifications for it rather than consulting experts, weighing the different options. And many experts believe that we would be much better off if we actually increased public funding, expanded the public system. And again, you often hear conservatives who will conveniently say, oh, but the Netherlands and Germany and France, you can buy private healthcare there. They also have much more expansive public systems and spend more public money than we do, but they have higher taxes. And so for conservatives, this may not be the case, but for a lot of people, they're willing to pay higher taxes in order to have better access to services themselves, but also to have a more equitable society where people are able to get the health services they need rather than going without care.
I think my takeaway from this paper, at least one of them, the big one, was that Premier Smith sees the current Alberta healthcare system as unsustainable. That it has to be changed in order to meet this new fiscal reality that she talks about, and she zeroes in on a couple of the things that you see that come out of the United States and Donald Trump's attacks on the administrative state. Bureaucrats are bad. They're inefficient. The private sector can always do better. So shrink the machinery of government, of which public health would be part of that, and put it out into the private sector. And we see exactly the same kind of idea in her paper.
Yeah, I think that's fair to say that she sees the private system as superior, but I really do think that's more for ideological reasons than it is grounded in any sort of evidence. I mean, when she reorganized the healthcare system and fractured AHS into four separate organizations, you had experts around the country and even around the world saying, why? Where's the evidence for a less integrated system, for breaking things apart into silos? Everyone else has been going in the opposite direction. AHS, while not without its problems, was viewed by many as a highly integrated example of what some other systems may seek to emulate. And so a lot of this is really ideological rather than, well, what does the evidence say? Because absolutely, the healthcare system needs reform and there are sustainability challenges, but those should be solved with evidence, not with ideology.
On that note, Lorian, thank you very much for this.
Thank you for having me.